So today I'll talk about Parkinson's, why we get Parkinson's, what are the treatments for the Parkinson's, what are the cardinal signs, which are the scales which I have to see. Here I'll just explain you in brief. Parkinson's, why do Parkinson patients struggle with movements? So Parkinson disease happen when the nerve cells in the brain that makes dopamine starts dying. So there is an area where I tend to remember as Niagara Falls. As you know, Niagara Falls is very big in size, right? And there is an area we call it substantia nigra. So in that way, I tend to remember. So the cells start dying. There is a progressive. Always remember, Parkinson is a progressive disease. So it gets slowly progressive. It may start from your 20s, and sometimes even the patients have in early stage, it's not diagnosed till it's 60, and the person will die also, and they'll with Parkinson's they won't know until unless it has been diagnosed. Okay, so the prevalence is from 20 to 60 years it can be seen. Use of dopamines helps in coordination, smooth and control movement. Without it, movement becomes slow, stiff and shaky. Okay, so it was named after Dr. James Parkinson. It was named after him, this Parkinson disease. So in here epidemiology I have written down from 25 to 50 years. Okay, is that's the age from we'll start from. After that, from 61% each years it increases more chances of having Parkinson's, and it affects all the races. It doesn't see which color you are, which skin color you have. It affects all the races, and the more prevalence is in the China. As you know, China has the largest populations, right? Even in India is very common, but in rural area, because rural area they use pesticides and all those things, and that's also affect. And even the new research has come up that even your gut plays an important role. It can give rise to your dementia, Alzheimer's and all, because those bacteria in your gut can travel through your vagus nerve to your brain, and it can cause neurological conditions. Okay, and the risk after 60 it increases more, because now you're having a progressive disorder plus you're aging also. So there's a chances for you to have Parkinson's. So after that I have written down what are the cardinal signs. So as you know, sign and symptoms and cardinal sign. In here I have written down the trap. Okay, trap. Just remember as a mouse trap. TRAP, in that way. So these are the four cardinal sign. Resting tremors. Whenever you give patient with the Parkinson's holding something and all, they won't have tremor. But when they are not doing anything, they'll have this kind of tremors, or they'll just keep on shaking in this. Okay, whenever the body is in rest, they'll start having the tremors. So that's why it's called resting tremor. So second will be rigidity. As you know, they become so rigid, and that's why there's a chances for them to fall whenever they have Parkinson, and they take a very small steps. We call it shuffling gait, very small steps, and they are very rigid. Whenever you do any exercises, they're very stiff and rigid. So akinesia, even you know the movements, they are very slow and they walk and stuff. Okay, and next is your postural instability. As you know, postural instability, they'll have forward head posture. Even the posture will be in this two posture. As you have observed any Parkinson patients, they'll have a two posture, or they'll have little bit forward head posture. So you need to see what kind of posture they are coming with. So these are the four cardinal signs you'll see. Okay, so there are stages of Parkinson's. So Parkinson disease is typically classified by worsening of scale. So manifestation I have written down. Modified Horns and Yen scale is one of the method to rate the severity of Parkinson's. So this Horn and Yen scales, you have to see it, because I have written down so there are stage 0, stage 1, stage 2, 1.5, stage 2 and 2.5, 3 and 4 and 5. So in here, suppose I'll just give an example. For stage 0, no evidence of Parkinson disease. There won't be any Parkinson disease, or even if it's there, you won't know also they'll have Parkinson's. In stage 1, what happens? There will be a unilateral involvement. You get it? Unilateral. In stage 1.5, there will be a unilateral and axial involvement. And in stage 2, there will be a bilateral involvement with balance in contact. Bilateral will be involved, but the balance will be in contact. So if you go from 2.5, there will be bilateral involvement, recovery to pull test. So you have to see in this, okay? Just go through this Young scale and just refer to it. So for the diagnosis of the Parkinson's, here I've written down. So Parkinson's, we have to do standardize is MRI and CT scans. So we'll see the small patches in the scan if there is any degenerative changes seen in the MRI. Okay, there will be a small spot we will be looking for. If there is any degeneration, it will be seen in the MRI and CT scan, and we call it PET scan plus your cardinal signs. So these are the diagnosing things for the Parkinson we do. And management, as you know, for the medications, we take all those levodopa and medications and deep brain stimulators. And now our part come into play, the PT management. So PT management doesn't mean only exercises being prescribed to the patients. So there's more things you have to look after it whenever the patient is suffering from Parkinson. So here are some signs or some treatment you can follow, okay? So whenever you're treating a Parkinson patients, work on their cognition. See how is their cognitions, okay? And you have to test. Usually in Parkinson's, visions and all are not related, but you just have to check, because when there is age related problem, vision, your swallowing problem and all these things can be affected. So just to rule it out, check for the visions, hearing problem and swallowing issue also, okay? And the posture, as you know, they'll have a posture instability. You have to use a posture corrections techniques, or anything you have to give them is to avoid any compensatory posture habits they are having. Suppose in Parkinson's they'll be in stoop posture or forward head posture, you just have to now correct those posture things, okay, and give the exercises related to the patient's conditions. And sensory impairment decreases due to aging. You have to check for the sensory impairment. As you know, after 60, everything there's a degenerative changes, so even the sensory impairment will be little bit less in those ages. So you have to consider even the sensory impairment whenever doing. And as you know, rigidity is there, that means range of motion is decreased. So whenever the patient has the fear of fall and stuff, they'll become very stiff, right? And the muscles are not even stretching properly and contracting properly as it should be. So what happens, they become more stiff and the range of motion decreases in the patient in the Parkinson's. So main thing what you have to do is the timing of the medicines when you prescribe the patients. So there's a timing for, like, if you're taking from 9 o'clock or 2 o'clock or 4 o'clock. So it depends on the time which has been given. So the timing for the medication is very important for the patient. And one more thing is, there's a new research that whenever you're taking a protein intake for the Parkinson patients, okay, uh, there won't be absorption of those dopamine. That's why you have to know the when to avoid those protein. Suppose some people, they have the habit of taking eggs in the morning because they'll have protein, okay? The outer part is the protein, the inner part is the fats. So you need to know when to avoid protein, because if you're taking protein and the medicine together, the dopamine won't be observed in the bloodstream. That's why there can be a delay in the healing. So and even the whichever medicine you're taking, it won't be that much effective. So these are the things you have to see. And even for your balancing, you have to see for the cognitions, and to start with the balance training exercises, or just check with the Berg balance scales and grade them in which scale they are there. If they need this and that, you have to work on their falls prevention also, so that even if they are walking independently, there should be less fall chances for them. So these are the small things you can do. And you have to see for their strengthening. If they require strengthening exercises, you have to keep on doing strengthening exercises, and daily functional mobility exercises you have to work on, okay? So in this way you have to progress. So as of now, the exercises things you can do it yourself, prescribe the patients properly regarding depending on their conditions, how they are. So you can give those exercises, but work on those exercises what they need most. Suppose they need mobility work. So my way, whenever I treat any kind of patients, I mainly focus on first releasing the areas. That means if they have some postural issue, I'll just release those tense muscles. I'll just use different techniques to release those. Then after releasing, what I'll do, I'll work on the mobility. Then after that, I'll go to strengthening. So whenever I'm treating any patients, regardless of any conditions, first I'll release, then I'll do mobility, then I'll work on the strengthening. Then after that, followed by your proprioceptive or your eye movements or all those things I'll do. So if you can have your own protocol how you do, but this is my way I do to treat patients, okay? So this is the small topics, small details I have shared with you all with regarding Parkinson. So next I have written down for you all the ACL. So tomorrow I'll share this video, ACL.